taking the right amount of your carbohydrates, proteins, fats, minerals and vitamins in the right amounts. So if your plate has the optimal of the above nutrients, we'll say you're eating well. For patients with cancer, the first thing we need to know is something we call the nutritional status, because we need to know if their weight and their height, what we call as the body mass index, is good. So if somebody has a normal weight, or somebody is underweight, overweight, or has obesity, the nutritional requirements change. So the first thing when somebody gets a cancer diagnosis, we need first to know the optimum nutritional status. That is the first thing. We need to achieve that. The next thing is what they put on their plates. So basically the first thing they need to look at is the complex carbohydrates. Complex carbohydrates is unprocessed energy-giving foods. So we prefer whole foods for the energy-giving foods. That is the macronutrients, and it includes the carbohydrates, our proteins, and our fatty acid, our essential fats. Our essential fats, we look at fats from nuts, seeds, avocados, and the fat that is liquid at room temperature. That is the good macronutrients, the nutrients that we need. Then from there, we also look at the essential micronutrients. Micronutrients we'll get from fruits and vegetables, which will be rich in the antioxidants and phytochemicals, which are good in preventing cell damage, clearing the bad like carcinogenic agents in food. And the other thing is hydration, intake of water. Water is very important. You need at least 8 glasses, which is equivalent to 2 liters in a day. If you need hydration, you should avoid the dehydration compounds like the fizzy drinks, like the sodas, the teas, the coffees. So hydration, you will look at the water. And then finally, and the most important thing, we will avoid the anti-nutrients. The anti-nutrients are processed. We have components that are used in processed food like the aspartame. There are those compounds you will try to avoid, and you'll find them mostly in processed foods. For the actual intake, in terms of calories, you need to see your nutritionist or a dietitian, because everybody has different calories that you need for the day. We call it the recommended dietary intake. But basically for the carbohydrates, we'll talk about 6 to 11 servings in a day, and that one will be translated very well by the nutritionist, the amount in your plates. For the proteins, you need a small percentage, like around 2 servings in a day. For meat, it's classified as a protein, and in protein we have plant-based proteins and animal-based proteins. Plant-based proteins are healthier, but you cannot do away from the animal proteins because they will give you the iron that you need for blood and oil. So you need, in a serving of meat is around 4 to 6 servings in your plates, and that will give you what you need. So we should avoid the intake of red meats. Heavy consumption of red meat has been linked to some types of cancers, and especially cured processed meat. Good meat is found from the white meats, our poultry, fish, and the red meat, which should really take in moderation. A serving is 4 to 6 standard pieces, cubes of meat. That will give you a serving. At least 3 times in a week, but you can do the meat alternatives where you have your legumes, and you can also do the white meat, because with the same different consumption from different, like from poultry, from chicken, from the red meat in moderation, and legumes, you're able to get your required protein per day.